For those of you who don't know me, I'm Laura Carfang. I'm one of the co-founders, along with my husband, of survivingbreastcancer.org. I was diagnosed with breast cancer about 8 years ago, so my organization, survivingbreastcancer.org, is about 8 years old. And my goal really is to provide education, resources, and community to all of you. I am so honored and thrilled to have developed the relationships with the panelists here tonight. We have Beth, Brenda, and Jen who are joining us. And I'm so excited to welcome them. They have all gone through various surgeries, including DIEP flap. Some of them have had complications. So we're going to actually talk and uncover like what can happen when you're going through surgery. Any surgery has its risks, and we're not going to shy away from those conversations. It is never meant to intimidate or provoke fear or anxiety. It's really from an educational perspective to say things that we need to learn about because we're all human and we all respond to treatment differently, whether it's radiation, chemotherapy, or surgery, we all respond differently. I'm also joined by Brenda, who some of you may know. She is part of our Spanish leadership team and one of the co-founders, along with me and William and a number of others of us here at survivingbreastcancer.org, who launched our Spanish initiative, Después de un Diagnóstico. So I really appreciate all of the work that you've done in terms of health equity, Brenda, and bringing us together, across language barriers and culture barriers. And then Jen, if you don't know Jen, Jen is like a rock star who leads our deep flap yoga. So like specifically, like are we not only talking about, deep flap surgery and what it means to go through a breast cancer diagnosis, but then for Jen to be part of our survivingbreastcancer.org community for a number of years and lead our monthly yoga practice, understanding the limitations that happen after surgery. And I can talk a little bit about my own experience too and some of the decisions that I made as a quote unquote yogi, if you will. But Jen, so great to be working with you professionally, but having you here to talk about your experience. And as a 20 plus year, person in the exercise space, like you really understand the like mind body healing connection, and the great work that you are doing. So stellar like peer-to-peer panel tonight, and I'm really excited to dive into the raw, the unfiltered, and surgery. Um, so without further ado, I would love to have each of you introduce yourselves in like the quick 2 minute pitch of what you're going, like what your experience has been. I think what's also really neat is like the timeline of your diagnosis, the stage at which you were diagnosed, and the timeline also of your surgery. Because again, on the call tonight and on the webinar, we have people who are listening in from, they've had it recently and they're recovering, or they're about to have surgery and they have questions. And so just giving the time frame of when you went through all of this is always really helpful. So Beth, why don't we start with you?
Oh gosh. Okay. I was diagnosed with stage 1B lobular breast cancer in August of 2022. And actually, I'm going to say July of 2022. It was 2 days after my 50th birthday, that I was diagnosed. I am the pillar of complications. Started off with a lumpectomy, a right-sided lumpectomy. I had complications that were, oh gosh, I had a wound that I had a 5 centimeter hematoma that actually dehisced my lumpectomy incision. However, with that being said, that's really not kind of my surgical journey. I ended up opting for a bilateral mastectomy after my margins were found not to be clear and I had one lymph node being involved. I had a 2 millimeter micromet on a lymph node. For anybody that doesn't know about lobular, I wish I would have known what I know now. A very sneaky cancer that often hides in different places. For me, my comfort level after they said we found these three additional spots plus this node, I said bilateral mastectomy. I was not offered the option of deep flap, and that's part of why I told Laura like I feel like this conversation is so important. I originally saw a plastic surgeon who offered me expanders and then implants. Um, I did that. I had bilateral mastectomy with under the muscle implants that were immediately placed. I did outpatient surgery. Once I did that, I had a complication. I had an infection 8 days later. I had a Jackson Pratt drain that was not functioning well, and I ended up in the hospital. The short version is 3 months, three hospitalizations, ended up at Mayo Clinic in Jacksonville, what I thought was on the verge of death's door, had radiation, full chest wall radiation, thought that my reconstruction journey was over. I thought that I would have to be flat. I was told I was very high risk to have any type of surgery. And I took a pause. I finished radiation in February of 2023, and I paused because I needed time to think about what it is that I wanted.
Mm.
I started really researching deep flap, and in June of 2024, I had my initial reconstruction. I had that in New Orleans. I live in Florida. I had to find I think very important to find the right surgeon, right place, and all that stuff. And then I had a revision in June of 2024. And that's it for right now. We're again on the pause. I can't do anything else.
So one step at a time, coming to
One
these
step at a time.
decisions and the roller coaster of like all of these emotions of finding out. So did your staging change then from one because it was now involved in the lymph nodes? Did your staging change also?
So I didn't really, they told me I was like 1A. They originally found I feel very fortunate, especially with having lobular. They found really a 5 millimeter one spot initially. And when it was all said and done, I only ended up being about a centimeter. And then I had three additional spots that were all, I mean, all in total, I was under 2 centimeters with the one lymph node. With the updated staging guidelines, they still put me at stage 1B, even though I had that micromet to the one lymph node. So maybe I changed from 1A to 1B, but it didn't affect my staging that much.
That's great to hear. I always tell people too, it's like, and I'm sure that I can see some nodding heads as well, where you're like diagnosed with a staging at initial, but I'm like, you hold on to that. You're like, this is the information I have. But then when they go in for surgery, they discover more information and that can change. And that can even change, whether you need chemo or radiation afterwards as well. And so, it's always like, sometimes I wish they didn't tell us because it can change, so, there's a lot that they discover when they open you up. Brenda, if I'm not mistaken, are you also lobular?
Yes.
Yes. Would you like to introduce yourself and your experience thus
Yes.
far with deep flap and breast cancer?
So my name is Brenda Coronado. I'm originally from Mexico, Monterrey, Mexico. I was diagnosed on April 2022. I was at stage one at the time. My doctor scheduled, and they told me that I was ductal. Um, my doctor scheduled my surgery on the double mastectomy on June of 2022. And then when everything came out, they found that it was mixed with lobular and ductal, and I was stage 2B. So that changed the whole plan. I originally was gonna go directly to radiation, but then chemo started in the conversation, and then they told me chemo, then radiation, and then we'll see from there. At
So
the
you're
time,
that exact example I was just describing, where you thought you were something and then it changed.
exactly. So that change at the time, I wanted to go from expanders to implants, but the radiation did so much damage in my tissue. And Laura can remember that I was taking meetings with no clothes, with my arm like this, because it was very burned. So it was really bad. So when that happened, my plastic surgeon changed me to, well, you either go flat or you do deep flap.
Mm.
So for me, it was like, I don't see myself as a flat, so let's go with a deep flap. And that's when I had my surgery on September 2022. And I had my revision, which was very simple, the revision. It was just to remove like a little, I don't know how to say it, like they put some extra tissue and they removed that. So that surgery was done on March 2023. And basically that's sorry, 2024. I'm all confused with that. Yeah, deep flap and the first surgery were on 2022. Then surgery for the deep was in September 2023 and revision 2024. So
So really like a multi-year process from start to finish.
yes, yes. And
And
the expanders were horrible.
and so you had the expanders.
Yes,
Um, yeah, so we
for a
can talk
year and a
about that
half.
too.
Yes.
Absolutely. Jen, what was your experience like?
Oh gosh.
Where do we
Um,
begin?
yeah, so stage 3C. I went in for the second mammogram of my life, December 22nd, 2020. So right during COVID. And then they said they're going to do a biopsy the next day. The biggest mass was about 7.5 centimeters, which I didn't even know any, I never thought about breast cancer before. Like I knew nothing about breast cancer. And then I got a biopsy the day before Christmas Eve. And then just waited for the results over Christmas and over New Year's. Because apparently there's not a lot of people working during that time. And then I finally, I was on Dr. Google a lot, which I don't recommend. Just went down the rabbit hole for
Totally.
2 weeks, just had a really bad holiday. Um, but kind of smiled and got through it, because I didn't have any certainty. And then January 2021, I was diagnosed, and the tumor had grown from 7.5 centimeters to 12 centimeters.
In that time frame?
Yeah, in 2 weeks.
Wow.
And I also had two other tumors. I had one 1 centimeter in my lymph nodes, and then another 2 centimeters kind of under the nipple area. So they put me right into chemo the next week, and I just like hit it just hard. And so 4 months of chemo, tumor started shrinking, and so then I had a lumpectomy. Um, and then they're like, okay, you're good. And I'm like, no, I'm not. I had learned a lot about deep flap from all my research and just talking to all my support groups and the women. And I said, I really do not want to go through this again. I was in my 40s, my early 40s. And I'm like, I have a long life to live. So I looked into deep flap, seemed like the best option. I had a really great surgeon and he offered an educational class about it to
Oh,
kind
that's
of
great.
yeah, to kind of let women decide. And it was like a couple hours, and he had implants there so you could feel them, touch them. And then he had all these diagrams and talked all about the risks and the recovery. And I still was like, I think this is the right answer, for me. I think that this is gonna work for me. So despite all the risks and everything, I was still like, yeah, I want to go through with it. And it really was my decision um, to go for it. And so I had my deep flap in August 2021. And then I had 33 radiation treatments, and that ended end of December. And then I went to Hawaii.
Oh, lovely.
It was like I wore my long sleeve bathing suit, and I'm just like, I gotta go. I gotta, I'm alive. And so I went to Hawaii. And then I had a revision the following year, just to kind of fill in the space because sometimes things get a little sunken in and they can just do a little, lipo from other parts and just fill it in and even things out. And then I actually have another revision surgery on Monday.
Oh, coming up, like
Yeah.
literally in a couple days. So, how long? I'll just start with you, Jen. So, like, why so many revisions? Like, why does the body change? Is it because of radiation afterwards? Is it because of treatment? Is it because of like things settling in? Can you talk to me a little bit about like
Yeah.
these revisions?
Yeah. So basically, it's the fat from the lower belly. And so your body, they never know exactly how your body's going to accept um, you know, the whole surgery. And so I didn't have any complications, by the way. No complications, which is, I tell women all the time, not everyone has complications. We hear about them a lot because in the support groups, people who have a lot of issues tend to go in and ask a lot of questions, but there are a lot of us who did not have complications.
Thanks for
And
clarifying that. Absolutely.
yeah, yeah, there's a lot of us. And so it's basically just a cosmetic thing. And it was just like a little indent and it just bothered me. So they're like, no big deal. So it was just an outpatient surgery, just a little fat grafting, not a big deal. Yeah.
Great. Great. I have so many more follow-up questions for that, but I'll get back to you on that. This decision-making process, I think we talked a little bit about like doing your own research versus being presented with options. Beth, how did you come to this decision and what was going through your mind leading up to the surgery?
Okay, so to come to this decision, Really, oh gosh, I hate to say I use social media, but I sort of did.
Oh, we all do. Who
I
doesn't, right?
like, so I originally I had a conversation with a plastic surgeon at Mayo Clinic, and she said, I really think, deep flap is is your best option. I did have full chest wall radiation. They did tell me that if I wanted to go the expander and implant route, I could. But she told me it was definitely full of risk and that she wouldn't recommend it. She said she'd do it if I wanted to do it. So at the time, I'll tell you, I mean, you go through three surgeries, the radiation, gosh, I had seeded, I mean, I had lots of complications. And I was just like, okay, like let me just figure this out. So I did go on social media and I researched like deep flap. I saw some physicians, I saw what they could do. I thought about it. I think the best piece of advice that I got was I had a nurse navigator. Her name is Nancy. And Nancy said to me, I know Nancy nurse. Nancy said to me, she goes, think of this as a fact-finding mission.
Mhm.
You are interviewing surgeons to see what they can do. And all I'm going to tell you this, there's a big difference in what people will do for you for deep flap. In terms of what they'll do aesthetically, they say your insurance will cover or not cover, if they'll fix your muscle, like, there's big differences in what people told me that they would do. Some people told me they'd remove the scar tissue under my arm. Some people told me they wouldn't.
Mhm.
There was a lot, that went into that. So I interviewed about four different surgeons, and I feel no shame in saying it because I think that every time I interviewed somebody, I found in another piece of information or another the question that I should ask when I went back. So I think that was for me, that was really important. I think if I would tell anybody advice, you want somebody who does this surgery all the time. They've done thousands of them. You want somebody that is very familiar, especially with your specific set of circumstances, whatever your circumstances are. I was like, I need somebody who has had experience with somebody who's had infections, who's had full chest wall radiation, and I want to know what your success rate is. My surgeon said, 99% success rate. I see people like you all the time. And I was like, that's it. Because first surgery, you're just looking to keep that flap to live. And that's how I went about the process of decision making.
That's incredible. Thank you. Brenda, what about you? How is your decision-making process?
Well, for me, it was either go flat or deep flap. So because my other option, which was the implants, was out of the table. So it was a personal, like I'm young, I don't want to be flat. So I just decided that that was the route. I did a lot of research. And to tell you a little bit of the story, literally 1 week before my surgery in September, we were at the retreat, and one of the ladies that was there had my surgeon as the second surgeon and her surgeon, and my main surgeon was where they were the opposite. So for me finding out, and she had a bad experience with the deep flap, for me finding out that my surgeon was the second on hers and my second was going to be his first, it was like really scary. But at the end of the day, as Jennifer said, like I was not in any complication, but that did scare me, and I was literally this close to back out, but everything worked fine at the end.
Everyone responds so differently, and we're clamoring, right, for those hope stories. We're clamoring to know that we're going to be okay. And we are. And I think, Beth, you are a testament to that after all of the complications that you shared, that you're here and you're smiling and you keep trekking forward. One of the questions, and I think a lot of you have alluded to this as well, what role does radiation play? I know for myself, I did not go through deep flap, but that's a burning question for me where it's like, you know, do you get radiation after surgery, depending on your treatment and your type, whether you're a triple negative or HER2 positive, your symptoms might be different in terms of treatment plans with chemo first and then surgery and then potentially radiation. I know people who opt out of radiation, et cetera. So there's like so many parameters, but radiation can really affect your skin. I know it can also affect, if you have an implant and then get radiated, some people need to even have their implants removed. I know we're talking about deep flap tonight, but just in terms of the role that radiation plays, does anyone want to speak to kind of how radiation impacted either your decision making or the outcome from your surgery?
I see a question here from Gabriella. Um, so that's a good question. Radiation was at the end. And so they're like, just do it at the end because it's more difficult to operate on radiated skin. I don't know like what you all did, but one of my nurses told me to put bleach on my skin. So I would take like a washcloth and soak it in water, cold water and bleach, and I put that on 3 times a day. And that towel would be like so hot on fire. It was just like so much burning. But I did that. And my skin, it's fine. And then the next year I was able to have the revision surgery, no problem. But they did like this whole side because I had 19 lymph nodes out. And, so they did this whole thing and they put this big plastic thing on me so it would concentrate the radiation into that section. Yeah.
Thanks for sharing that, Jen.
I would say for me, for radiation, radiated skin never behaves the same way that your skin is going to behave. Most surgeons told me 6 months. I know there's one surgeon that I know that I can think of off the top of my head that will do it at 4 if you're depending on how your skin looks. For me, they used my abdominal skin instead of my chest wall skin because that skin doesn't expand as well. And then they used it on my left side, even though it wasn't radiated, so that my skin matched.
Mm.
For me, radiate like how that affected my deep flap is you're higher. Gosh, I hate to say perkier, but perkier on the right side. So for me, part of my revision, because the radiated side didn't fall the same way as my non-radiated side. So part of my revision was they go in and they lift, they got a lift to try to make me symmetrical. And I mean, I think they did a really nice job, but that's for me, that's my radiation story.
Did any of you, since you're talking about symmetric, alignment and everything, when I got radiated, my cancer breast with the radiation actually shrunk. And so, do you experience any of that? I don't know if like shrinking is the same as like perkiness. I don't know if we're using the names like synonymously, but like, did you had like changes physically because of the radiation?
My skin on that side, my deep flap is more down and the other one is the perky. So
Mm.
for me, it did change the, I guess what's the word? Elasticity of
Okay.
the skin, and that one is a little bit down and the other one is happier.
I like that. Jen, you were about to say something too?
I said higher and tighter on the radiated side.
Ooh, tighter and tighter. I like that too. Awesome. Very nice. I know I feel like I have a good side now and a back side, and I'm like always cognizant when I'm taking pictures because of proportions, right? Like things closer to the camera look larger. So my smaller side's always first. And then, I'm just very cognizant that I now actually have a preferred, it's my good side. Um, preparing for surgery, we've gotten a lot of questions from those who have RSVP'd for tonight's webinar is how do you prepare, not just like physically, like, what do you need to have at home? We talked a little bit about the JP drains and, having scars and pain and, you wake up the next morning and I always tell people like, I wish someone prepared me to wake up and know that I'm going to be inflamed, enlarged because I'm swollen, and black and blue because I just went through surgery. I don't know why I was super naive. I woke up and I was like, I thought I was going to have the best breasts in the world. But no, I just went through surgery and no one actually reminded me of the reality. So I would love to like talk about how do we prepare for surgery, not just leading up to, but then waking up from and coming home. Like what are the physical things we need to know as well as the mental? Brenda, can we start with you on, preparing the night before? Like what's going through your mind? And did you go, like I actually went to, what was it? Like Bed Bath and Beyond and I splurged and bought like 6 different pillows because in my head I was like, I need pillows. I need pillows behind my head. I need pillows under my arms. I need pillows in the front. And that was like my $250 splurge at Bed Bath and Beyond.
For me, it was I ordered one. It's like a foam that has this shape because I read that there was gonna be very difficult to lift up. So I slept in that thing, and then I had another pillow, one on each side, so I can like push myself to get out of the bed, for
Mm,
example. So that was
mhm.
part of my preparation. I also had one collar for the it's like a hanging back where you put the drains,
Drain.
and I had one that clip into my because the belly one was literally on this side.
And how many
So
drains did you have?
three.
Three. Okay.
Yes. And I also got there's some wipes that are very, it's not alcohol, but they help you clean. And I had a bunch of those to try to clean mainly the areas where the drain connects to the skin because that got a little bit of irritated. So
Mm.
that was my physical preparation. Mentally, because I had the scare a week before my surgery, I just tried like that's not my story, and tried to concentrate on everything's gonna be okay. My mom was here helping, so I tried to let it go and just go ahead with my decision.
Absolutely. And speaking of drains, does everyone know what like these JP drains are? I think Elizabeth used, Beth used like the actual term of what JP actually stands for. But these are these drains, and I actually did a YouTube video on like how to actually milk the drains and help you because you can have so much extra fluid and so much extra blood coming out. I am very squeamish. I made it very clear to my doctors I do not deal well with pain. I do not deal well with sights of blood. So this idea of like having a tube coming out of my body into this drain that's collecting my fluid that I would have to empty myself was very traumatizing. And Beth, I think you mentioned that you had an experience where your tube, your drain wasn't actually functioning properly. So to talk a little bit about complications, but like overcoming complications, do you want to talk a little bit about that?
Sure. Oh my gosh, I've had a total of, I think, 10 drains during my process of having breast cancer. Um, so complications. So your Jackson Pratt drain should drain. It is connected to your body. And I guess I have the benefit of being a nurse, so I've had to deal with JP drains before. Um, for me, what was very frustrating at the time is I'm going to tell you, if it could go wrong, it did. I was supposed to have home health to help my husband after I had my mastectomy. They accepted and then declined my referral, so there was no one there. It was my husband and I. Um, then I called my physician and said, like, listen, this isn't draining. Like, you should see stuff coming out of that drain. And if it doesn't, I called. They told me that I was overdoing it, that I was, like that I was anxious because I was diagnosed with breast cancer. And they basically ignored me. I ended up in the hospital 2 days later. I would say trust your body. My husband, who is not a medical person, was like, "You clearly you are swollen, you are in more pain." Um, I would say if you are in doubt, call your doctor. If you don't feel like your doctor is listening to you, go to the ER because I ended up in the ER and I was what they would term septic. So I was very sick. I had cellulitis. They thought I was septic. They told me I almost died from my surgery. It was actually a very traumatizing experience, but I mean, drains are very important. It is a very, like, you need to know, and I mean, I guess we all have, I guess most surgeons would have like some kind of education that they provide. You want to make sure the drain is flowing, that you understand how to milk a drain, that you should, like, what color that fluid should be when it's coming out, that red color, that if there's, you're going to have some clots in there that they might back up, but it is really important. And I would say any doubt, call your doctor. But I did have I mean, I'm going to say point blank, I know I had a bad experience, and I don't think that's most people's, but that was mine. Um, After that, I became like very much, very
Yeah.
much like drain person.
And I appreciate you sharing that because without your experience, we wouldn't know what to look for. And so I think that's why it's like so educational and so important. Breast cancer is not, rainbows and roses. Like we need to talk about the realities and have the hope and the successes, but also realize any surgery can lead to complication. Anything, any illness, the cold can lead to pneumonia and other things, right? And so I really think, I really appreciate you sharing the realities and then still being here today to like smile and let us know like you got through all of this. Jen, what about you? So leading up to how did you prepare at home? How did you like mentally prepare? Were there like items that you were like a must have leading into surgery?
Well, I'm kind of a hoarder, so I had like all my things that I could possibly need. But I would say most useful, just a little lanyard around the neck, and then just pin the drains on there when you take a shower because you can't have them hanging. I had 6 drains.
Six. Oh,
Yeah,
tell me. Okay, I knew about four. Tell me about six. Where are they coming out of?
coming out of the hip area, and then
Oh, okay.
so I had a lot of drains. And so my husband's an engineer, so he kept a spreadsheet
Oh,
of
I
the
love that. I love that.
he needed something to do, right? They always do. So he had a spreadsheet of how much liquid was coming out every time, and he would send that to the nurse over the message. So he did it all because yeah. So like hold the top really tight, and then you just really hard squeeze down and get the liquid into the little bulbs, and then you just unscrew them and change them, and then he would, measure them and just keep track of that. So I got my drains out after like 2.5 weeks. Uh,
Mm,
which was really good. Yeah, use the spreadsheet, use the spreadsheet. Um, and just a nice pillow, to put your hands on because
mm,
you're not hunched over, you're just kind of hinging at the hip because when that scar or that cut comes across the pelvis area, it shortens the skin. So you're actually kind of hinging a little bit. And then you have to learn how to straighten up, which is what in deep flop yoga, we do a lot of upper back strengthening. We do a lot of just gentle chest opening, and walk and just move. Like I
mm.
was up walking around. I was doing, laps in the yard. Don't just sit there all day because then you get more stiff, you get more tired, and then moving keeps the blood circulating. You're not going to feel like it, but do it anyway. Um,
Mm.
it keeps, things going. It's just so good for you, and it promotes healing. So I would say the pillow, the lanyard, and just keep moving. Yeah.
Follow the lanyard, totally.
It's easy.
I actually got something that almost looked like a tool belt to wrap around my waist.
Mhm.
And because I was nervous about sleeping and rolling over and accidentally squirting out this blood everywhere. So I literally got this like tool belt, like apron, and stuck my drains in the like in the pockets. And I slept on my back. I'm not a back sleeper, but like, I made it work. But just knowing that like the drains had like the secure home was like very helpful. So yes, all of these great tools. And similarly, I also started moving shortly after my surgery. I started walking, and my mom, just like you, Brenda, was home and visiting me and helping me. And I remember saying, she's like, "Oh, you can't walk. You need to rest." And I'm like, "Mom, I got breast surgery. My legs are fine. I can walk." And so, like, it's just like one of those like humor moments of like, mentally, like we can do so much more. Yes, the breast hurt. Yes, the stomach hurts. Yes, we're going through all of this, but like my legs didn't hurt and I could definitely walk a few blocks around the neighborhood and the fresh air. I was taking a medical leave as well, so, right? So like mentally being able to leave the house and go outside, all of these things really add up. So recovery, one of the questions that I think we get a lot too when you think about deep flap is the abdominal surgery, right? So like deep flap is taking the tissue from your abdomen, your lower abdomen, to reconstruct to the extent possible a natural form of your breast molds and etc. So not only are you dealing with like breast surgery, but you're also dealing with like abdomen surgery. How is that recovery? What does that feel like? And what can we expect recovering from literally, like, I'm not standing up right now, but like your whole torso having gone through this dramatic experience? Brenda, do you want to talk about your experience in recovery and about how long approximately? Like, what did it feel like? Were you on any pain meds to help you manage the pain? And, what was your mobility like?
Using pain meds, not too strong because the pain wasn't that bad. It was more the being uncomfortable of having that. It was like a big thing holding my belly, and then obviously the drains and all of that. Uh, for sleeping, those pillows on the side helped me to secure. So I was not in that much pain. And I think it took me probably like 10 days to be like, I started moving like a couple days after. And even in the hospital, the nurse like pushed me to walk and do laps around the hospital. Uh, but it really took me probably like 10 days to be more mobile and to start driving. And then after that, I stayed working remote for about a month. And then I started being fully going to work and operational.
Great, thank you.
Cooking was out of the picture because you cannot be with all that surgery, you cannot be cooking. So I was just helping prepare, cut things.
Excellent. Beth, what about you? What was your like wake up moment in recovery like?
Okay, so I think I told you before, Laura, my wake up moment was amazing for me. I just remember waking up. I mean, you got to remember, I was the girl that they said, like, this isn't going to happen for you. There's a high chance of failure. But I remember coming out of like anesthesia and hearing the nurse and the PA talk, and they said, all I could hear him say was, "Oh my gosh, she's so like, look how symmetrical she is." And I, at that moment in time, was, like that to me was amazing. I do think it's worth mentioning, in terms of what your experience is. Be prepared. They are going to wake you up every hour.
Oh
They are
yeah.
going to check that blood flow every hour, and you want them to do it. Like you want them to come in there because that flap can fail, and you want them to Doppler that. And I mean, for me, very reassuring. I know everybody has a different thought on being woke up, but for me, I was very reassuring. I almost felt like when they were like, monitoring my baby or something, like it felt very reassuring for me. I also think, based on there's different protocols. Like my mastectomy protocol was terrible. Like I did not have a regional block and I went home the same day and I was miserable. When I woke up from this surgery, I would say, I was not I mean, I was obviously on pain medications. I had a PCA pump so I could push the button for the first night. So for me, the pain level was okay. I was up and walking the next morning. Got up now, it hurts. Like, there's no doubt it hurts. And going to the bathroom the first time,
Mhm.
like, that's what you got to do. But I'm always one of those people like, get me out this hospital. So up into the bathroom and I went back to the hotel. So I was actually at Hope Lodge in New Orleans. So
Oh,
this
great.
is definitely very, very doable surgery if you need to stay somewhere. A lot of places, especially if they deal with a lot of people that come from out of state, can help you find lodging and all the things. And you might need to stay, 3 or 4 weeks so that they can monitor you. But that was it. I'm also going to add in as a must have long phone cord for surgery. Must have. If you want your cell phone, you want a long phone
Mhm.
cord. So because you're probably going to want to call somebody or watch, something or,
That
text
is
message.
such
So I'm going to
practical
add that.
advice.
That's
I
my
love that.
practical. Lots of people that I've heard from say an electric recliner is a must. Now, I did not find that to be true, but I've heard a lot of people say that they needed that to help kind of boost them to stand up, but I didn't find that to need to be true. But I took 8 weeks off for work. And then I went back. I think a lot of this depends on physically how demanding is your job that you need to do. And also, I would say everybody's different. I felt so bad. I knew people that are going back to work 2 weeks post deep, and I was like, oh my gosh, I'm like a total wimp here. But I'm going to say this in the end, this is about you and how you feel. And it's not just even about physically how you feel. There is a big emotional component to this. And if you
Totally.
need some time just to process, take the time if you can have it. I was lucky I went back to work, maybe even half days for, a couple weeks, but that would be my recovery. But yes, basically it was just abdominal tightness. I did have my abdominal incision opened up. I did see Laura one of the questions. My BMI is above 30, so it is a risk. My incision, they said superficial opening, but I did have treatment for that. And I did send pictures every week, but in the end, I mean, it closed. I know sometimes it feels like forever, especially when you have complications. It feels like forever. You're never going to be better. This is never going to go away. But eventually it does. I mean, it does go away. And I mean, my scars look great. I mean, I'm not gonna, flash anybody my scars,
We
but
can't know.
I
We're all like,
can,
woo.
I'm not gonna, but my scars look really, really good. And they can even do scar revision. And when you go in for your revision surgery, if your scars are more pronounced, they can help bury those to help make you look, so you feel good. I mean, the point of this is so you feel good about you. Um, and that's so, whatever it is you want, whatever questions you have, that's what I would say. Ask those types of questions.
That's a really good point. And you brought up so many great educational points here too. Like we're not medical doctors. We can't say exactly 100% like what the guidelines are. But about the BMI, who is eligible for deep flap surgery? I think that's a question we get a lot. And so, based on our research at survivingbreastcancer.org, the range typically is between 25 and 30% BMI. We've seen typically on average, most people doing like 23 percent BMI. Very few hospitals will do something as low as 20% BMI. So, I think this just goes back to there isn't a national standard, but it really depends on what your doctor is looking for. And as we've heard tonight again and again, everyone's story is different. To use your language, Brenda, like your story is not my story. What is your body composition? What is your physique? What is your height? What is your structure, et cetera? Like, are you pear shaped? Are you apple shaped? Like, what all the things, right? And so, there's so many things that come into the factors of who could actually be eligible for this. Um, and then to some of the earlier questions that we heard too, have you had radiation? Will you be getting radiation? Are you a candidate for this? What are the success rates? Are you willing to take some of these risks the way Beth you were mentioning as well? I'm being told that you might not be a high candidate for this, but you still went through it because you felt in your gut that this was like the right choice for you. You also bring up, oh, go ahead, Brenda, go ahead.
BMI was never brought to my conversation at all. Never. So it's for me, I heard that before and I read about, but for me, my doctor, my surgeon never mentioned it. Just to put a point there.
That's great. No, absolutely. So sometimes it comes up as a question if it's offered to you, if it's not offered to you, who the candidates are, who would be eligible. That's a great point. Um, to piggyback off of what you were saying, Beth, I'm going to kick a question to you, Jen, about like identity and getting back to work. And, after going through a breast cancer diagnosis and surgery and reconstruction and treatment, I think so many of us are like, go, go, go. I see like the light at the end of this tunnel. And I just want to like get over this. I need to get through everything. But for many of us too, it's also like, that's actually for me personally, like, that's when it hit me. It like was really hard for me once treatment was over, for example, as someone diagnosed with early stage breast cancer. I still feel like I'm mentally grappling with shit. I just found out I had cancer. Like, whoa. And I'm going through this like really intensive, invasive surgery. I'm losing a part of my identity in terms of like femininity, my breast, different things like that. Um, and I didn't sign up for this. Like how do you reconcile all of this and what did you find to be helpful tools for you to like reclaim yourself?
I
It's a
think
very heavy question I'm just throwing at you, so thank you for taking it.
it's different for everyone, but for me personally, my daughter was 6.
Mm,
So I did it for her.
yeah,
Um, every time I looked at her, it was like, I can't leave her. And I think, if you're a mom and you know what I'm talking about, you do anything for your kid. I just feel like I just had to be strong. And I'm one of those people I like to like, I was like, I'm gonna make this my job, is treatment, and I'm gonna do my best and get through it. And I did. And that's what I had to do. Um, and I went back to work right away because I teach yoga. So it's like,
yeah,
please. So I still had drains in and I was taking clients over Zoom. Um,
wow,
but it just made me feel like myself. And anything that you love, keep doing it, do it more, you
do it more.
know,
I love that.
and just the people that matter are going to be there, and the people that don't, they're not. And that's okay, you
Yeah,
know, and don't feel guilty about taking care of everyone else's emotions. I think that's a big one. People were like, "Oh, why didn't you tell me?" Well, it's not my job to tell you it. It's not about you kind of thing. So just setting boundaries.
Yeah.
I also had a therapist, breast cancer therapist. I had a breast cancer psychologist, and my daughter had a therapist and a social worker. And so they gave her coloring books. She talked to someone once a week. We had all kinds of books about like mommy loses her hair. Like that was really helpful.
Yeah,
Um,
absolutely.
I use all the tools. I used Healing Touch, which was all, so this is like right after COVID, so I couldn't even, go anywhere. Um, but yeah, just like virtual Healing Touch where someone was setting an intention for me to heal and I would lie there for 30
Oh,
minutes, days
so
a
good.
week. And I'm an energetic person, so I really felt that. So
Yeah.
just, yeah, take care of yourself and don't let anyone tell you what you should or shouldn't do because you know.
Oh, everyone has a freaking opinion. It's so annoying.
It's annoying. And I did say, please, no opinions. Like,
Yeah,
no advice, no opinions. I don't want your advice. I don't want your opinion.
so
Yeah.
hard. So hard to put
Unless,
up those boundaries.
yeah.
Oh, thank you for sharing that. You know, one of the things that I've learned having gone through not deep flap, but just surgery and cancer in general, I did not know how many surgeries were involved. When I was diagnosed with breast cancer, I thought surgery, one and done. So what I'm hearing tonight also is this, you know, pathway of not just one surgery, but like surgery, potentially expanders, then, exchange and revisions and this process. So for those who are considering this type of surgery, one of the questions I always say in our document of like questions to ask your surgeon is like, how many surgeries will I actually need? And does this surgery actually impact, what brings me joy? Is like, can I go through all these surgeries and still practice yoga? What is my upper body strength going to be like afterwards? And Jen, I think you're a testament to that. What's it going to be like to pick up and hug my kids? And, and what's interesting is I had what I call a double lumpectomy. That's not the actual like technical term, but I had a lumpectomy on one side and reconstruction on the other, so things could be symmetrical. Then I had radiation, so things are no longer symmetrical. But even with lumpectomy, I still had 3 drains. So everyone's like, oh, lumpectomy is like an in and out easy. It's not easy. Nothing about cancer is easy. But some of the tidbits that I would like to share is like I'm a big coffee drinker. To me, coffee was really important, still is in my life. I couldn't reach the top shelf to get the coffee cup out. I asked my husband, let's put all the coffee mugs on the counter. I want to be able to get my coffee and get my mug and pour myself coffee. And like, these are the little things that you're like, I don't want to feel that I can't do something. I couldn't reach to the top shelf after surgery. And I don't know if you guys experienced this either, the friction and the suction of the refrigerator. Opening the refrigerator was actually like painful. And no one told me that. So there's these like little things that got better over time, but I'm trying to think mentally, what are the things that like I will feel empowered with? Buying button-down shirts. I can't tell you how many button-down flannel shirts I have right now because I wanted to be able to get dressed in the morning versus putting things over my head and dealing with all the drains and all of the things. So, these small little things that gave me agency and control over a situation where I felt so miserable. So I just wanted to share some like pre-surgery things that really helped me outside of my splurge on all of my pillows. Are there, because I do want to open this up. I will stop the recording and kind of bring this back for the community so we can have a further discussion and Q&A with everyone who's here tonight. But before we conclude, is there anything that we haven't covered that you really want to share with our audience or anyone who's going to be listening to this recording afterwards about your experience with deep flap surgery? I'll just open that up for Beth, Brenda, and Jen.
Everyone's so different. I had a 12-hour surgery and I had the double mastectomy, and then the breast surgeon went out and the plastics came in, and that was that. But I was in the hospital for 5 days. So ask a lot of questions, get a second opinion if you can wrap your head around it. Um, yeah.
Yeah,
Oh, and write things down because you won't remember them.
so true. So true. Any other comments or questions? Or one thing I just saw in the chat as well, what do your guys' belly buttons look like? Did the belly button get impacted by the surgery? Okay, so
And I can tell you a funny story that just happened to me. So my belly button was very low. And a couple weeks ago, I started having, and now it's very top. I started having what I call a phantom stress, like giggling in where my belly button used to be. And I'm
mm,
like, is this normal? Because I started feeling like it was like it's itchy. So I started like try to rub it and try to find. My husband was like, well, ask your doctor. So I went ahead and asked them, and they are your nerves where they were are trying to recover their
exact
skin.
and reconnect and
And
yeah.
that is so that happens if what I call it that the phantom belly button, and you couldn't stop it, so it just started like scratching. But yeah, that happened.
Yeah.
I'm trying to feel it to see if I have any feeling there. Not real. I mean, I know where it is, but it's just, it's like a little more, it looks different now. It's like a little more stretched out like that.
Yeah.
No, it doesn't bother me. I don't care. It's
Yeah.
fine.
Thank you.
Yeah. Yeah.
And Beth, same, no problems.
I didn't have it. Yeah, my belly button was okay. I mean, I guess, I have I have some numb spots, I guess, in my abdomen. That's the one thing I guess I would mention is that you might want to ask, or like, it's always surprising to me, the numbness. But I do have a couple, I have kind of some spots that are still a little bit.
Yeah.
Someone
Awesome.
asked about nerve grafting, I think. I was reading through the questions. I had that, and I am getting more feeling now, a few years later. So they said it will come back over time, but I'm part of a study where they'll like poke and be like, do you feel that? Do you feel that? Um,
Mm,
so yeah, it's really interesting because at first you don't feel anything, but yeah, I'm starting to feel stuff.
that's great. That's
Mhm.
great.
I asked about resensation is something because when I had my mastectomy, they did not offer me that nerve sparing mastectomy, which I've seen now. But I asked my plastic surgeon about it. I do think it's a worthwhile question to ask. Now, he said, for like in my particular situation, he said he's only saying that be successful about giving back about 30% sensation, but it probably is because, I mean, they severed everything initially for me. So he said, breast nerves, there's a lot of them. Even he said typically they've used those drugs in like hand and wrist, which apparently have less nerves than your breasts do, which I did not know until he told me that. But that was I did see that question as well. But I did ask about that.
Yeah. I think we go through mammograms. Like, hello, how many nerves do we have?
I know.
So, well, thank you all so much for sharing your personal experiences, the good, the bad, the ugly, the realities. I think, having this space where we can come together as patient advocates and share our stories and answer each other's questions and share hope is really, really important. So I thank all of you for being not only part of the survivingbreastcancer.org community, but here sharing your voice and letting others know that there's hope, and these are where we are today with deep flap surgery. So I'm going to stop the recording and we can open things up to the community. But I just wanted to like publicly say thank you all, Beth, Brenda, Jen, for being here tonight. And I really appreciate you sharing everything that you've gone through. I know it's like rehashing trauma, but we're getting stronger because of it.